Dr. A. David Rahimi is board certified by the American Board of Dermatology and is a diplomat of the American Board of Cosmetic Surgery. Dr. Rahimi graduated magna cum laude from UCLA and graduated Alpha Omega Alpha from the George Washington University School of Medicine. He completed his residency in dermatology at Mount Sinai Medical Center of New York and is fellowship trained in cosmetic surgery. All this talent has not gone unnoticed. Dr. Rahimi has been featured in Variety Magazine, KTLA Channel 5 News in Los Angeles, and the Penn and Teller show on HBO titled Fountain of Youth.
A god to his patients, he's just one of the 2.5 gazillion plastic surgeons in Beverly Hills.
How much younger can you really look? I'm Dr. David Rahimi from Forever Young in Los Angeles.
Dr. Rahimi's main concern for his patients is safety. By using mild sedation with local anesthesia, he avoids the hazards inherent in putting patients under or general anesthesia. The doctor approaches the needs of every patient with great personal warmth and genuine interest. His philosophy is that minimally invasive techniques can realize maximum results. According to Dr. Rahimi, patients should look like their best self, not someone else. Dr. David Rahimi is also the co-director of a cosmetic surgery training program approved by the American Academy of Cosmetic Surgery. As part of this training program, surgeons from all over the world spend a full year to learn the art and science of cosmetic surgery. Dr. Rahimi is married with a beautiful wife and daughter. The family lives in Los Angeles.
Los Angeles is the recognized world capital of plastic surgery. After eyelid surgery, the most popular procedures focus on the appearance of the middle and lower face.
A tulip lift is actually a surgical mini facelift that's done under local anesthesia and mild sedation. The procedure takes about 2 hours to perform. Results can last 10 years or longer, and because it can be done under local anesthesia with mild sedation, patients benefit from a safer surgery with quicker recovery and a very cost-effective surgery that can be afforded by most people.
Dr. Rahimi explains the procedure to his patient Linda as he marks her face prior to the surgery.
And the way we tighten the skin is with the tulip lift. And the tulip lift has 3 components. The first component tightens the face horizontally. The second petal of the tulip addresses the jowl area. And the third petal of the tulip addresses the neck area.
According to Dr. Rahimi, within 10 days, friends and family will be unable to tell the patient had surgery. They'll just notice how refreshed and youthful the person appears. Far less invasive and safer than most conventional facelifts, the tulip lift is an outpatient procedure that requires only local anesthesia with mild sedation.
So in about a week, we're going to take the sutures out. There's going to be a fine scar underneath the chin and in front of the ears. And a couple of weeks after that, I will either laser or chemical peel those areas to get rid of all the sun damage and make the scars appear almost imperceptible.
The shot was probably the most traumatic thing. I didn't feel anything during this. Oh great, I'd recommend it to everyone.
She's going to look 10 to 15 years younger when we're all done with her.
Unlike traditional mini facelifts, the tulip lift is also customizable to address patients' specific concerns.
It looks very natural. You know, when I told people that I was having this procedure done, everyone was a little nervous that you get that pulled look that's very obvious, but you know, everybody, and I totally agree, it looks very natural.
I'm very passionate about my work and I take a lot of pride in what I do. Most people don't want to look drastically different. They want to look the way they looked 10, 15 years ago. Because it can be done under local anesthesia with mild sedation, patients benefit from a safer surgery with quicker recovery and a very cost-effective surgery that can be afforded by most people.
In Los Angeles, midlife is not the same as it used to be. You are the only one who needs to know your age, and leave everyone else guessing. Hands are often the first area to show the ravages of age. Most commonly, damage appears as thinning skin, protruding veins, and brown spots. According to Dr. David Rahimi, Los Angeles dermatologist and cosmetic surgeon, the visible signs of aging on the hands of women and men may start occurring as early as the 30s and 40s.
Most women neglect their hands and chest. Even if they've had a facelift or laser resurfacing and they have beautiful skin on their face, they have hands that give away how old they are.
From his Forever Young clinic on Wilshire Boulevard in Los Angeles, Dr. Rahimi regularly turns back the clock for his patients. Through a series of outpatient, minimally invasive, and FDA-approved procedures, Dr. Rahimi can make hands appear to be 10 years younger.
Well, I'm very fair-skinned, so over the course of time, particularly hands and face would get a lot of brown spots. One thing I didn't realize is that when you're driving, you don't think about it. You have your hands on the steering wheel and the sun is hitting them all the time. So I was getting a lot of brown spots and things like that on the back of my hands.
His approach to hand rejuvenation begins with the chemical peel. Working with the body's natural tissue-building properties, this technique removes the sun-damaged skin cell layers. Dr. Rahimi uses the patient's own living tissue to plump up areas in the hand.
The next part of the procedure is applying thermocool, which is a non-surgical lifting procedure to tighten the hands and the arms. Finally, a laser is used to remove keratoses, brown spots, and irregularities of the hand.
I'm very happy with my hand improvement. I feel the brown spots are almost gone, and the hands look much more plumped up, much younger, more youthful.
This patient came to me and was complaining that her hands looked like her grandmother's hands. And as you can see from this before and after pictures, many of the brown spots are gone and the hands look beautiful.
The encouraging message is that visible signs of aging on the hands of women and men now have help in new cosmetic procedures that give lasting results. In Los Angeles, the city of personal reinvention, younger hands are just a phone call away. Everyone wants to look and feel their best. Advances in cosmetic surgery have made surgical and non-surgical procedures safer, more affordable, and more effective for a wider range of skin types.
Olive-complected people actually age differently than people with European skin. We have devised programs here to address the aging skin and the aging face of our patients who are of Hispanic background, Asian, or even African American background.
Following cosmetic surgery, African American skin may develop thick and unsightly scars. Hispanic and Asian post-op patients can experience noticeable light or dark skin discolorations.
I was very self-conscious. It did not make me feel good at all.
And my acne scars were really, really notice. Everybody can notice, but especially my nose and on my sides, I really have scars.
Due to these sometimes unpredictable results, patients with dark and olive-toned skin may be discouraged by less experienced physicians from seeking laser treatment, chemical peels, or cosmetic surgery.
I've had over 10 years of experience, having lived in New York, Los Angeles, and Washington, D.C., to devise a program that's perfect for patients with darker skin complexion.
Dr. Rahimi originally studied as a dermatologist, and then, as he puts it, he just decided to go deeper into dermatology, especially for people of color.
You can make people look 10 to 15 years younger by using different disciplines within cosmetic surgery and dermatology to address the different parts of the aging skin. Light and medium depth chemical peels can be used to remove age spots and brown spots. Fillers such as Restylane, collagen, and even your own fat can be used to soften deep lines. Non-surgical techniques such as thermocool, which is a non-surgical tightening from inside. And finally, our trademark tulip lift, which is a surgical facelift that's actually done under light sedation and local anesthesia, can be safely used in patients with olive complexion.
I was afraid, but then when I started talking to Dr. Rahimi, he made me feel so comfortable.
Anyone can suffer from acne, regardless of age or ethnicity. Dr. Rahimi uses the Cool Touch brand laser to remove acne scarring gradually and without surgery.
After the treatment, there was no pain at all. I went home happy, like nothing had happened to me.
I saw nothing. No mole, just a regular smooth skin, and I thought, oh, well, gee, I think I'll have the rest of them done.
The results are long-lasting and scarring and risks are minimized.
I am so amazed at my face, my skin, and everything now. I'm just so pleased.